fuels and blusters. These are actually medical terminology that can be understood easily. So I think the most common doctors have prescribed NSAIDs, antibiotics, and some other specific disease drugs like allopurinol, anticonvulsants. So you must all people know at your level when you practicing as a GP. When you become as a consultant, you know everything. But some people are not going to become higher education. तो उनके लिए बहुत ही कॉमन है. सम स्किन ड्रग्स होती हैं, जैसे कोई डर्मा वाला खुद ही है, उसको टर्बेनाफाइन लिख दिया किसी मरीज को. दैट्स अगेन एंटी फंगल ड्रग. And he has prescribed for any racial reaction. So it will cause the acute generalized xanthomatous pustules, like pustules, pus cells ban jayenge, and durations will be 1 to 3 days. That fungal infections like over the axilla, groin, any fungal infection. And any some sort of other infections we have also advised that we will find. And again the antihypertensive here is the diltiazem, that you know is again the drug that we prescribe by the cardiologist, has some reaction. So you must understand which drug I prescribe and the patient gets rashes. This is actually the same doctor. The drugs which he prescribed are advised to the patient, he must know the reactions. And even very common drugs we use is the augment and beta lactam that can again cause these generalized xanthomatous pustules. Still I have not seen, I have seen the side effects of the augmentin is the loose stools, very common by giving the oral, either in the tablet form or in suspension. So when you prescribe any beta lactam, you must have some sort of in your mind, it could cause the rash, could cause the loose stools. That's very common at your final year level, you must know. Again, very common, this is again penicillin, that's again augmentin, and amoxicillin, naphthalene, niacin. So these all can cause the reaction. That is actually the marbley form. You can see over the Google, these are the images over the Google. If you write down these words and typical reactions, the common is the Stevens-Jones syndrome, common is the photosensitivity, that's very common. But I have mentioned here the Stevens-Johnson, that other is urticaria, angioedema, some sort of reactions as drug rash with the systemic involvement, like patient can present with the like a parasitic infection. This is a failure बन जाएगा patients की. उसको जो है systemic symptoms को reach शुरू हो जाएगा. तो उस derma वाले के पास जाता है. So when the patient comes with the derma, they give them some oral drugs, some topical drugs, and some steroids. But when come over a physician, he must give the albendazole, mebendazole, like Xanthil. He knows what is the cause behind it, can be the larva, can cause the drug reaction. So this is very important. You know people in the final year, that's very common and very easy approach. The penicillins, ceftriaxones, cefotaxime, ceftazidime, all these drugs cause these pink macules or papules like dengue virus, like viral fevers, but this is more inside. So you must know which you have to prescribe your drug to the patient. Duration is no, it's in between the 1 to 2 weeks. Very urgent, very immediate basis पे एनाफाइलेटिक रिएक्शंस होते हैं. it is within the hours and the minutes, seconds, that is called the photosensitivity reaction, allergic reaction, anaphylaxis reaction. That's very rapidly occur when you are giving any drug or IV to the patient. So important is the urticaria. You must know that either it is from the drug-induced urticaria, angioedema. You know everyone, very common. It's a hereditary, inherited disorder also. C1 deficiency. You must have to rule out first. When you prescribe any patient's S inhibitors, you prescribe any commonly joint pain and you prescribe the NSAIDs or any opioid NSAIDs, opioid analgesics. So you must have to rule out first what is inhalation history you must take properly. Then you think about your patient what I have to prescribe. That's very important at your level final year. Though it's not so important lectures, but you must know regarding the drug reactions, very common. When you go into your books or even on the Google, you can search out the images. If you have the networks, you can see, and actually the USB has been not properly functioning, so I will definitely give you these images over your projector. So you can see yourself, you are a final year student, must know, you write down urticaria. So these images like wheels over the areas is very important, where you see these reactions can occur over the eyes, lips. This is again very common. Over the trunk you can see, break up the body and over the trunk. Urticaria is very common. And you have some manual bedside technique that you can line up over the arm or the body that will be immediate, comes out red, pink. So you must understand this is the urticaria. Again, there is a drug rate. Actually, we have discussed all these. Now, yes, another important, how can we differentiate some painful rashes? Some rashes are very painful. Painful rashes, some disease can cause. We can say painful ulcers. These are the painful ulcers. If it is a disease cause, you know everyone कि वो कौन सी इन्फेक्शंस हैं जो पेनफुल अल्सर्स कराते हैं और पेनलेस अल्सर्स कराते हैं. आप सबको पता होगा, नहीं तो मैं बताता हूँ. herpes zoster is again very painful rash or ulcer. That's very painful. Syphilis is painless. So at your level, at your family, if any examiner asks you बेटा पेनफुल रेशेस किन कंडीशंस में होते हैं और कौन सी ड्रग्स कराती हैं, तो यू कैन से कि वेरी कॉमन एंटी इपिलेप्टिक इज द फेनिटोइन, दैट इज द लोमोट्रिजीन, इवन द एंटी गाउट इज द एलिफेरेनिल. These most common drugs which we have to prescribe by the neurophysician or any rheumatologist or any physician, allopurinol, that can be very painful. So you can differentiate by taking the history, either it is a STD, sexual transmitted disease, or I have to prescribe the drug that can present like that. So it's up to you how you have to take the history of the patient and evaluate the patient properly with your clinical websites. So what is the management plan? What can physician, what can dermatologist plan for the management of these diseases? Who will tell you this very common sense? क्या करोगे बेटा सबसे पहले?
सबसे पहले ड्रग्स जो धीरे वो रोकते हैं, जो ड्रग जिससे
कॉन्फिडेंस होना चाहिए.
पॉजिटिव एसिड
क्या करोगे सबसे पहले?
ड्रग देने उसको रोकते हैं.
जी सर. एग्जैक्टली द कल्प्रिट
एंटी एलर्जी
ड्रग जो है ना, जो आपकी कल्प्रिट है, जो आपने उसको ऑफर की है, उसको आप स्टॉप करेंगे, अवॉइड करेंगे। पहले तो ये सोचेंगे कि कहीं मैंने जो इसको एलिपेरानोल दिया है, गोलियन दिया है, मैंने कोई फेनिटोइन दिया है, मैंने इनको कोई जो है सेफ्ट्रेक्सोन दिया है, या मैंने आर्मेंटल दे दी है, या मैंने कोई अदर ड्रग दे दी है, एमसिस या ऐसे रिमिटर्स दे दिए कि इसकी वजह से नहीं हो रहा है इसको, आई हैव टू स्टॉप। ठीक है, इफ देयर इज अ रिएक्शन इज वेरी सिवियर एंड इंटेंस, then I will go for the steroids. First of all, very immediate drug. So either the long-acting steroids or the short-acting. So I will prescribe short-acting, that is the hydrocortisone, solopartol के नाम से होता है market में. That is very short-acting and immediate acting. Dexa is long-acting. So I will immediately give the patient steroid like hydrocortisone to prevent any anaphylactic reactions. The one of the best treatment plan is to avoid that drug. So these symptoms which presents over the body with by your examination as a rash, papules, macules will be inshallah settled down within 48 to 72 hours. And you can follow the patients up to 1 week or 2 weeks. It's up to your disease severity and your follow-ups. You can rule out these things by investigation, by sending the labs to rule out all these things. You will send CRP. It's an inflammatory marker. Infection can be caused infection ESR or any serum IG level. That is again the immunoglobulins that can be drug reaction can be raised in these situations. So you have to rule out the systemic disorders or some other special local test, that is the skin patch reaction test होता है, we take the biopsies, we take some sort of sample over the skin. If we suspect it any malignancy, not just because of the drug, not just because of the so local biopsy can you send to evaluate your patient and to reach your proper disease or diagnosis. In a very short, cutaneous manifestation is the family syndrome, other reaction that's very common when you become a physician. You must have some sort of this opinions, some sort of your mind should be go for these. Actually, important thing is that minutes to hours, I have already mentioned, is the anaphylactic reactions, urticaria and angioedema. Angioedema means vessels edema. Patient has the laryngospasm, can gasp, can descend. It's very critical, very serious complication at your monitoring cells like ICU, HDU, CCU. That patient can be in a gasping state from 96 to 76, 66. When you come in your family, you are posting here gynae, some sort of iron preparation like Venopur that can again cause these angioedema type reactions and some anaphylactic reactions. The patient immediately descends, hypovolemic, going into the hypovolemic shock, and some sort of symptoms, constitutional symptoms like fever, can feel, and headache, vertigo, dizziness. These can be present by the patient. So important बेटा, this is very important कि आपको याद क्या करना है, ये दवाइयाँ common ये अगर आपको नजर आ रहा है प्रॉपर तो प्लीज ये चंद ड्रग्स है, दैट्स वेरी इंपॉर्टेंट। ये कहना कि बहुत सारी दवाएं मौजूद, दैट्स वेरी कॉमन। तो कॉमन एटलीस्ट आनी चाहिए। could be a DCQ, could be when the exam will be when you are become appearing in the final year exam. So I think you must have to write down these common drugs, especially anti-convulsant, especially anti-uric, and common reactions like Steven-Johnson syndrome is very common in your monitoring cell. And I have seen these reactions like patient can present with the itching, rashes, and we are giving the full antibiotics in the monitoring cells. So this is the grace again, like any status epilepticus patients which are continuous have the epilepsy or fits, we are giving the phenytoin, valproate, lamotrigine, even the lalap, and even the epival, to 3 to 5 anti-epileptics we are giving, and this results into this reaction with presence with the lymphadenopathy. That's very common of the phenytoin side effects. अगर कोई पूछे कि ड्रग्स का क्या है कॉमन, बहुत सारे कॉमन इसके साइड इफेक्ट्स होते हैं phenytoin के। अगर lymphadenopathy, when you are working in oncologist and you have some history of patient with epilepsy and have developed the lymphadenopathy, you must think about that. So please write down all these drugs and their durations is very important. By reactions you know everyone. So this is very brief lecture over your cutaneous drug reactions. There is no any high significance at your level. This is totally purely derma related. Once you go into the subspecialty in dermatology, you must go into the details. There will be size, there will be number of that rash, there will be the margins of that rash. They know the strength or the depth of that rash. They will calculate accordingly and treat accordingly. So this is very easy. I think we have not go in a detail for knowledge. It's a very common. You must know these most common reactions which are very described by the table. ठीक है भाई? So this is the end of your lecture. Avoiding your dead drugs, give the steroids. You prepared very well today, but lecture is very short.